Good morning, guys.
Morning.
Any questions? Nobody have any questions yet?
No.
Okay, guys. So what we will be doing is, okay, yes, we'll start off with chapter number 3, which is about what we call the integumentary system. Okay, guys, now this is going to be, yes, okay, one of the smaller or, yes, okay, shorter systems that we may talk about. Okay. Now, first of all, yes, okay, let's just talk about, yes, okay, just briefly mention that, okay, yes, what are the organs? Or, let's put this way. You say like organ and glands in the integumentary system. Now that's going to be respectively as okay. The first one is going to be skin. Clear? We can say as okay. What we also have in the integumentary system is going to be here, and okay, as we here comes things such as okay, as the hair follicles. What we also will have is going to be as okay, what we can call the sweat glands. What we also will have is going to be as okay, what we call the sebaceous glands. And okay, as the last structure is going to be as okay, what we will call as okay, the nails. Is that clear?
Yeah.
Okay. Now, guys, as far as our discussion goes, yes, okay. We will only be talking about skin. We may be as okay, just briefly be as okay, talk about the sebaceous glands and sweat glands. Okay. Is that clear? That mainly means okay that we will not talk about the hair and hair follicles and the nails. Okay. So these as okay, 3 things that are tick marked is going to be as okay, the 3 main points that we may as okay talk about. Did you guys get that?
Yes. Yep.
Okay. Now, guys, let's just go and see. Right. So one by one, yes, okay, we will talk about these structures here. Okay. But first, yes, okay, let's just talk a bit about, yes, okay, what are the main functions of your skin. Okay, what's going to be the main functions of the skin? Now, so first of all, yes, okay, was the integumentary system. We can say, yes, okay, it plays an important role in maintaining of homeostasis. How? Mainly, yes, okay, two major ways. We can say, it's okay, by regulating body temperature. And another way by which it is okay is, we can say, it's okay, responsible for maintaining its okay homeostasis is by, we can say, it's okay, regulating the fluid balance. And it's okay by fluid balance, that's okay, also it's okay, maintains okay, we can call it okay an acid base balance. Is that clear? Okay. Now mainly guys, yes, okay, the body temperature is mainly as okay. First of all, it's going to be as okay regulated by help of what we call as okay the subcutaneous layer, which is going to as okay be made up of fat or adipose tissue. Another ways by which is okay the integumentary system is okay will play a role in is okay maintaining the body temperature is with help of sweat glands. Okay. So what is okay the subcutaneous layer is going to be doing as a, which is mainly is okay going to be made up of fat, that's going to act as an insulator. Mainly as okay prevent the body from losing it's okay the heat energy that it produces, and in that way it's okay keeping the body warm. Whereas okay the sweat glands mainly as okay does the opposite. Is mainly as okay going to keep the body cool. And what we also can say is okay by doing so is okay that's also going to play as okay a vital role in affairs maintaining the fluid balance of the body. Now, guys, how it's okay, we may say it's okay we lose not drastic amounts, but it's okay certain amounts of fluid is okay via sweat. But what we may is okay just mention later on is that okay, yes, in case of had we not had the skin, okay, in case of yes, okay, patients who yes, okay, suffer extensive burns, okay, they are going to yes, okay, have a hard time yes, okay, regulating yes, okay, the fluid balance of the body, mainly yes, okay, because we can put this way, it says okay, in case of burns, what's going to happen? There's going to be yes, okay, an increased loss of body fluids. So pretty much okay, as what the skin does it actually is okay, retains the fluid in the body. Clear? Did you guys get that? So yes, okay, in case of absence of skin, probably yes, okay. In most cases, yes, okay. If that's the instance, yes, okay. Due to burns, what's going to happen that the patient actually is okay will have no ability to yes, okay, retain the fluid, and actually that's going to be yes, okay, huge losses of body fluids. Did you guys get that?
Yeah.
Yes.
Now another function that okay we can say is okay, which means that's okay will be is okay one of the major functions of your skin is that okay yes, or let's say it's okay the integumentary system is it acts as what we will call yes okay the first line of defense. Okay. So your skin, or yes, okay, we can say the integumentary system is going to be acting as a first line of defense, which mainly mean that it stops any, yes, okay, we can say it's okay, invading substance. Now, when we say invading substance, that will be, yes, okay, primary, yes, okay, when we talk about being, yes, okay, a line of defense is going to be, yes, okay, things such as, we can say, it's okay, bacteria, viruses, and so on, so from entering the body. Clear? Okay. Which may also say also, okay, how does, okay, things such as bacteria and so on, so yes, okay, enter the body. That is going to be, yes, okay, if there is a, what they call a breach of the, yes, okay, if there's, okay, first line of defense, which would be your skin. So if you said, okay, if this here, yes, okay, was the skin, and there was a breach in that first line of defense, which is the skin, that will mainly mean that, okay, as you had a wound. What that wound is actually going to be is going to be as okay an opening in the skin, which means as okay may enable as okay the as okay bacteria to enter deeper. Or we can say it's okay actually it's okay pass through the first line of defense or deeper to the skin. That's pretty much okay as how we can say it's okay that the wound gets infected. Does that make sense? Did that make any sense?
Yes.
Yeah.
Okay. You were this close for me shutting down the session. So I don't know. Okay. What mainly is okay prevented it from happening was that okay had the skin been intact, the first line of defense were being intact, and okay yes, the bacteria, germ, whatsoever yes okay was not going to be able to yes okay get underneath the skin. Okay. Okay, guys. Now another thing. And mainly as okay, as far as okay as the functions of the skin. Or let's say it's okay, the integumentary system. You can say it's okay, the subcutaneous tissue. Now, just in a little bit, it's okay when we talk about it's okay, different layers of the skin. We mainly it's okay, say that okay, this subcutaneous tissue here. Actually, it's okay, it's going to be made up of fat. Now, let's just do it this way. And we say it's okay, the subcutaneous tissue or fat. Now, guys, it's okay with help of what we can call it's okay, sun rays. Actually, it's okay is going to be able to, also we can say it's okay, responsible for it's okay, the production of vitamin D. Okay. So it's actually that's okay with help of okay, sunlight. That the subcutaneous tissue actually that's okay will be responsible or that's okay be able to produce what we call vitamin D. Okay. And what vitamin D is going to yes okay mainly yes okay be responsible for, or you can say it's okay help it. And okay, yes, it's going to help it. Okay, yes, we can say it's okay, the absorption of calcium. So you can mainly put it this way that okay, yes, if you do not get enough exposure to the sun, well, okay, yes, subcutaneous layer will not be able to yes, okay, produce enough vitamin D. And if you're not producing enough vitamin D, you will not be able to yes, okay, absorb enough calcium from yes, okay, from your gut. Okay. But maybe we can say, it's okay, this calcium here is okay, where will that be going to? To make your bones material, if you want to put it that way. Or not to make, let's say, yes, okay, let's put it this way and say that it would be necessary to strengthen the bones. Did you guys get that?
Yeah.
Right, okay. Right. So sunlight helps, or actually, as okay, causes, that's okay, this subcutaneous layer here to produce vitamin D. And this vitamin D is going to yes, okay, mainly yes, okay, help in the absorption of calcium. And this calcium is okay going to be considered okay deposited to the bone and actually it's okay going to strengthen the bone. So what does that mean? That will mainly mean that okay, yes, if you don't have enough exposure to the sun. Well, okay, the production of vitamin D is going to be reduced. Now you can consume as much vitamin D as you want to, but it's okay, sorry, calcium that you want to. but it is not going to get absorbed. So you will actually, that's okay, have a decreased or reduced absorption of vitamin D. And that's actually going to, it's okay, we can say it's okay, reduce the strength of your bones. Why? Mainly because of all this, yes, okay. If the body is okay, needs calcium, that calcium is mainly as okay, is going to be as okay, mobilized from the bones.
Did you say immobilized?
It's going to get
Okay.
mobilized from the bones.
Okay.
Okay. So it's a matter of okay as balance. Right. Okay. Yeah. So that's okay. Now, strange enough, that's okay. Vitamin D, okay, is going to be okay what they call a fat soluble vitamin. Okay, out of yes, okay, all the vitamins A and the multiple B's, C, D, E. It's mainly as okay, just 3 vitamins which are going to be what we can call as okay, fat soluble. A as an apple, D as in donut, and E as an elephant. Those are the 3 fat soluble vitamins. Okay. And here we can mainly say, okay, due to yes, okay, yes, okay, it being yes, okay, fat soluble, yes, okay, it's going to yes, okay, mean yes, okay, be produced by the fatty layers in the skin, which is going to be yes, okay, your subcutaneous tissue. But what is a must for the subcutaneous tissue to produce vitamin D is sun exposure or exposure to the sun. Now, some of you will say, okay, how did they get to know about that? Now, what they found is, especially in the slums of London, okay, okay, yes, it was very, very narrow streets with tall houses or tall buildings, let's put it this way. That the people who actually okay were living down here didn't get enough sun. And due to that, yes, okay, what they started to see was that, okay, yes, especially, oh, shit. All right, that was not mentioned. Right? Okay. What they mainly, yes, okay, saw that, okay, yes, the bones of those people actually is okay were misshaped. That was what they call is okay rickets. And the question comes, okay, why was it? Primarily, yes, okay, because they didn't get enough sun. And that's why it's okay in states like Connecticut, it's okay. Now it's okay. What's the condition of the sun? Okay, the sun may be out, but it's still too cold to sit outside, right? If you sit outside with okay, it's with a big hoodie, well, okay, you're not getting enough exposure because okay, the skin is still covered up with it's okay, your big hoodie or whatever. So that's why you may see that okay, yes, a lot of people may have to take yes, okay, vitamin D supplements. Why? Because their body is not producing enough vitamin D, right? Why? Because of too less exposure to the sun. Why? Well, okay, the sun is gone. Did you guys get that? Okay. Now, with all these functions here of skin, what's going to be okay, one last function of the skin? Or let's say it's okay, the integumentary system. And let me put it this way, it's not written in your book. So don't even try to look it up.
I know you said the first layer of defense, but it's also protecting like your internal organs.
Well, okay, my dear, yes, but there should be more to the skin than just, okay, the skin to protect, right? Okay. I haven't mentioned it in any ways. But that's why it's okay. I'm asking. Let's see, it's okay. How much out of the box somebody will be able to think. No idea. So you guys give up? Okay. Guys, it gives us beauty. Well, guys, that's okay. It's Halloween coming out, right? What do most people, that's okay, do for Halloween?
Dress up.
Okay. Well, also, it's okay, put some crazy makeup, like, okay, as the skin is falling apart or something like that, right? Okay, it's trying to, yes, okay, it looks scary, but yes, okay, it also looks. Okay, would you like to see yourself as you are right now or as a ghost? So yes, okay, guys, okay. Besides, yes, okay, most of these functions, yes, okay, where also does it, gives us, what you want to call it, yes, okay, beauty. Okay. Now, guys, the components of your integumentary system. And as I said earlier, yes, okay, we mean, yes, okay, just going to talk about skin, the sweat glands, and the sebaceous glands. Okay. Now, let's just start off with Mr. Skin. Now, guys, first of all, yes, okay, what is it that the skin is going to be? Well, okay, yes, it is the largest organ of the body. Is that clear? And when
Yep.
we say it's okay, the largest mean, yes, okay, can make up to, yes, okay, 17% of, because it's okay, the body mass is made up of your skin. Okay, so 17% of the body mass is made up of skin. Okay. We can also say, yes, okay, now as far as, okay, the skin is concerned, yes, okay, it's mainly, yes, okay, going to be made up of 3 major layers. And guys, yes, okay, the 3 major layers of the skin is going to be, yes, okay, the epidermis, under which we will have the dermis, under which we will have, of course, what is called the subcutaneous layer, and or this subcutaneous layer may also be known as the hypodermis. Did you guys get that?
Yep.
Yeah.
Okay. So the 3 layers of the skin is the epidermis, the dermis, and the subcutaneous layer also is okay called the hypodermis. You guys can see this PowerPoint here?
Yeah.
Yep.
Okay, guys. So okay, let's just make it. Oh, oh yes, okay, guys. If we say that this is the skin, or we can say, okay, the skin. This here, or we can say, okay, these 2 layers here. That is going to be, yes, okay, your epidermis. We can say that, okay, as this here. That is the dermis. And this part here is okay, that is the cutaneous layer, or what we also call the hypodermis. Did you guys realize that?
Yeah.
Yep.
So we said this here was the epidermis. All this here is okay was the dermis. And then it's okay, these yellowish structures here is okay, that was your subcutaneous layer or hypodermis. Okay. Now what you may see is okay in the lower levels. This joker head here. That is okay, yes, going to be, it's okay, your pigment cells, or what we later on refer to as the melanocytes. Okay. But what you actually also may see that, okay, yes, your epidermis as a whole, well, okay, there's no nerves, there's no blood vessels, etc., in it. Okay. This part is okay, that's your nerve ending, but that's just okay what you have in the dermis, which is underneath the epidermis. You may say, okay, it's okay. What happens is, okay, your ear follicle. Oh, sorry, your hair actually is okay, passes through the it's okay, through the dermis, but it's okay, it actually is okay, originates from the dermis. So it's okay, it's going to be, it's okay, you can say it's okay, your sweat glands. Or okay, it's going to, it's okay, open. That's okay, or pass through, it's okay. It's okay, a sweat duct from the sweat gland. The sweat gland themselves are in the dermis. Now, guys, if you look closer to the epidermis, you may realize that, okay, the epidermis is going to be made up of two layers. You may see it's okay, a difference between it's okay, the texture of, let's say it's okay, this layer here versus the layer below it. Right, okay, now if you look, let's say it's okay, at what this looks like versus this. So these are going to be as okay, the two layers of your epidermis. Are you guys clear?
Yep.
Good.
Yes.
So let's go back to our regular PowerPoint. So what we mainly can say is okay that okay, as if you looked at it, it's okay, we said okay, as the epidermis was made up of two layers, right? Now this uppermost layer of the epidermis is going to be called as okay, stratum. Where I said that the word stratum. Actually, that's okay, just meant layer. Is that clear?
Yeah.
Yep.
So it's going to just, okay, the uppermost layer of your epidermis is going to be called stratum corneum. corneum. So the RMA, so we can say, okay, that's going to be, okay, the superficial layer of the epidermis. It's going to be called stratum corneum. Whereas, okay, yes, the lower layer of your epidermis is going to be called stratum. Well, okay, the stratum still, yes, okay, just means, just okay, layer. Germinativum. Germinativum. Stratum germinativum. And we can mainly say, okay, that this is going to be, okay, the deeper layer of the epidermis. Did you guys get that?
Yes.
Okay.
Yes.
Or if you just look at it, okay, yes, let's do it here again. Right, okay. We say that, okay, yes, this layer here is, okay, that was the shallower layer or superficial layer of the epidermis, and that was what we call the stratum corneum. Whereas, okay, yes, this here is, okay, was the deeper layer of your epidermis, which we call, yes, okay, the stratum germinativum. Did you guys get that?
Yeah.
Yes.
Now, guys, as far as, okay, sorry, these two layers are concerned, we mainly will say that, okay, yes, your stratum corneum, which is going to be, as, okay, the shallowest, most layer, superficial layer of your epidermis, actually was going to be made up of, okay, what we call the squamous. Oh, sorry. Stratified, because it's going to be, as, okay, in more than one layer. But then it's okay, when you look at the shape of the cells, they are somehow flattened, so that makes it squamous. And okay, yes, epithelium. So that's means it's okay why we say that, okay, it's skin. Well, okay, the epidermis is going to be made up of stratified squamous epithelium. Now, guys, what mainly happens is that a cell from, let's say it's okay down here, or it's okay from a deeper layer of, okay, yes, your sternum or stratum germinativum. Mainly, yes, okay, is going to, yes, okay, we can say, it's okay, migrate up. And eventually, it's okay, become a cell of your stratum corneum, which is going to, actually, it's okay. What eventually will happen is that these cells, yes, okay, will shed off. That's what you call dandruff. Okay. So what does this journey here take? How long does this journey, yes, okay, take from down here all the way up here? Normally, yes, okay, that takes 21 days. Or roughly, yes, okay, 3 weeks. So right now, yes, okay, guys, a cell that is going to be, yes, okay, part of, okay, yes, the stratum germinatum of our skin. In 3 weeks from now, it's going to, yes, okay, have reached to become, yes, okay, a part of your stratum corneum, and actually, it's okay, it's going to shut off. That some of you may be scratching your head and say, but okay, yes, that would mainly mean that, okay, yes, by now, yes, okay, we should be have been depleted from stratum corneum or stratum germinatum. No, because what we actually have here, let me just say, it's okay, use this color here. We can, yes, okay, say what actually, yes, okay, separates between, yes, okay, the epidermis and dermis is what they call, yes, okay, the basal membrane. And what the basal membrane means is that's going to be doing is, okay, just producing new cells that become new cells of your germinum, is okay, stratum germinativum. That's okay, guy, as far as, okay, your teeth are concerned. Okay. That kind of change, that's okay, only happens once. Well, what is it you have? A head. I hope you just don't have it now. But you had what you call milk teeth, right? But you forgot about those? And milk teeth. What causes them to fall out?
New ones.
New ones. And where are those new ones coming from? Or where do you find these new ones or new teeth, which are going to become your permanent teeth? They're deeper down in your gums, right? But maybe it's okay when they say, well, okay, it's now time for us to come out, that they actually, it's okay, push on your milk teeth and they become wiggly, 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 and okay, yes, it's okay, ultimately, it's okay, falls out. So the same happens here. Just new cells, just okay, produced by the basal membrane becomes new cells of, okay, as your stratum germinativum. and may just okay push on the cells above them towards the stratum corneum, which may just okay just push on upon the cells which already are there, which are going to cause them to shed off. And that's what you call dandruff. Well, not okay, because okay, the difference between yes, okay, dandruff and okay, yes, that's okay. It may yes, okay, for some people, yes, okay, appear in the form of dandruff. So this is, as you can say, is okay, an unsensible loss. You don't really realize it. It just happens. Did you guys get that?
Yes.
Now, does anybody have any idea, yes, okay, why they call the basal layer, or yes, okay, the bottom layer of your epidermis, the germinativum? No idea? Okay, if you look at the word germinativum, what comes to your mind? Or is there something that may look similar?
Germination?
Germination. And what is germination? Or when
Like the start of something? Like when something starts to germinate, like it starts to grow?
Exactly, because that's mainly okay, what happens when you plant a seed, right? And usually that's okay when that seed just okay grows into a plant or tree or whatever it's going to become. It goes this way. So the community says, okay, the reason that they call it as okay stratum germinatum is that okay, as that means yes, okay, going to be from where yes, okay, the skin cells will germinate and grow. But maybe that's okay once they reach yes, okay, the top level that eventually okay, they will be shed off because more cells are getting germinated or produced. So that just okay, that journey from the bottom of your stratum germinativum to the top layer of the stratum corneum takes 21 days. Okay. So the skin that you may have now is okay. In 3 weeks from now, it's okay. It's going to be completely replaced. Now, any questions?
Nope.
No. Okay, so we can mainly say that okay, yes, ultimately is okay, the light that was green, or yes, okay, the stratum germinativum may turn yellow. And then okay, yes, becomes red. Now, guys, it may sound strange, but that's okay. The stratum corneum. Actually, that's okay. It's going to just okay be what we can call it as okay. keratinized cells. Now, what the word keratinized are, that's okay, actually, it's mainly because of, okay, it's a substance that we call keratin. Keratin. And okay, as in certain parts of the body, that's okay, that's going to be, that's okay, we can say more keratin, and that's going to cause, okay, the skin may be hardened. They call it, okay, the word keratin, or keratin, actually, it's going to be, that's okay, actually, that's okay, the word carrot, K-E-R-E-T, actually means hardening. Any questions?
Nope.
Nope.
And where is it with me? That's okay, we're fine, that's okay, we can put it this way. Increased, that's okay, keratinized cells, and that's okay, the stratum corneum. That's going to be, that's okay, in areas of, let's say, it's okay, let's put it this way, palms of the hand and soles of the feet. That's why it's okay, that's going to be, it's okay, increased. But eventually it's okay, it is going to be shed off. But it's okay, it started its journey at the stratum corneum germinativum, and eventually it's okay, become part of the stratum corneum in 21 days. Now, guys, what I said was that, okay, as between the dermis and epidermis, there was, okay, as this membrane, which we call as, okay, the basal membrane. Okay. And one kind of skin cancer that actually is, okay, develops in the basal membrane is what they also is, okay, call basal membrane carcinoma. Okay. Now, back in the days, we also, yes, okay, used to refer to this one here as carcinoma in situ, SITU. So that's okay. Basal membrane carcinoma was also, yes, okay, referred to as carcinoma in situ. So that means it's okay, a form for, that was meaning it's okay, a form for skin cancer. Did you guys get that?
Yes.
Yes.
Now let me just take you guys back to our diagram here. Not just to make clear, it's okay where I'm. What you talk about? Okay, guys. Now, if you just look close, can you guys see the PowerPoint? Okay, PowerPoint?
Yep.
Good.
Yes.
Okay, thank you. Now, my dear, if you look here, and it's just okay, follows okay this operation. Again, that's okay, the outline between epidermis above and the dermis below. Okay, you can actually see that, okay, it runs like this. Okay, where we mean is, can see it's okay. Above this line here is okay, that's where we had the epidermis, and below it was where we had the dermis. Right, okay. And what you actually will see is, okay, that, okay, yes, the dermis may as okay, make, okay, as these wave-like projections into the epidermis. And likewise, as okay, the epidermis may make, okay, these wave-like, okay, finger-like projections into the dermis. And what they are going to be known as, that's what actually is okay, we collectively is okay, may call it to the way. The dermal, mainly it's okay pertaining to skin. Oh, maybe it's right down here. Papillae. Is that clear?
Yeah.
Okay. So yes, okay, these yes, okay, finger-like, yes, okay, projections of the epidermis into the dermis and epidermis into the epidermis is going to be called the dermal papillae, where the word is okay, papillae or papilla actually is okay, just going to be okay, a term for a projection. Okay. They may even is okay call what some of you may know as a pimple, as a papilla. Technically. Now, guys, comes the $1,000,000 question. Why? Why did we have to have, yes, okay, the epidermis and epidermis as okay interviewed together like this? Why couldn't it just have been, yes, okay, two layers like this on top of one another? Why did they have to be intervened like this?
To deliver nutrients?
I mean, yep.
To deliver nutrients to the top layer? Blood? Okay.
Well, okay. But that's not the primary reason. Yes, anybody want to say something? Dr. Tracy, you need to exercise your vocal cords, dear. Do you mind to say something? That's okay. Why do you think that they are like that?
I don't know.
You don't know.
No.
Not even
Not any idea at all.
Okay.
Would it be to make, because like there's all the glands and such in the dermis, and just the way that it's aligned, like maybe the touch and the pressure receptors.
No idea. Okay. Let's do it this way, guys. Look here. If I place my hands like this, okay, and I tell anybody, can you separate my hands? That's going to be easy, right? Somebody's going to put on my right hand, somebody's going to put on my left hand. They will go like this. Whereas, okay, if I put him like this, we call this pretty much okay, or something like this. I say, okay, now separate them. Okay. So mainly it's okay just to prevent that, okay, yes, your epidermis doesn't slide on top of the dermis. But they actually, it's okay, are intervened like this. That could be, it's okay, one reason. Clear? Where you can say, okay, you can say, it's okay, establishing, it's okay, a good grip between the two layers of skin, dermis and epidermis. Okay. Another thing is that, okay, yes, that this line between, yes, okay, the dermis and epidermis also is going to be, as okay, we can say, as okay, richly vascularized. That's going to be as okay as huge network of microscopic blood vessels.
That's capillaries,
That,
right?
capillaries, yeah. Okay. So it's going to see as okay be heavily as okay vascularized with capillaries, which mainly as okay is going to as okay enable the skin to as okay perform that function of okay as regulating body temperature. But the main reason that okay that they are intervened like this together, and that's like this, or this, is so that okay, yes, that there actually is a good grip between the dermis and epidermis. Did you guys get that?
Yes.
Okay. And some of you will say, well, okay, yes, how much of a grip? And now, quick guys, this may become a little graphic, but we actually just okay had a person who was brought into yes okay the department where I was working once on the emergency, and he actually had what they call as okay deglowing injury. What the mainly is okay meant by that mainly is okay most of just okay his skin was ripped off. And now the part that made it okay as even more as okay graphic is that okay it was not just skin on any regular body part. but it's okay, of his penis. All the skin of his penis was ripped off. And some of you will go, at how in the hell did that happen? Well, okay, I guess he was operating a machine and wearing an apron. And his apron got caught in that, and actually it's okay. That's how it actually is okay. When the machine is okay. Whatever kind of machine that was, so that's okay. He was brought in, and it's okay. Now, how do we fix this? Yeah. So, but I mean, that's okay. So I guess that's okay. Although it's okay, there is some strength link between, yes, okay, the dermis and epidermis, but that's okay. Here that was too much. But in a matter of fact, it's okay. Even it's okay, the dermis was taken off as well. So what we need to just had to look at was okay, yes, the deeper structures of, yes, okay. Okay, guys. Now the dermis. Okay. But guys, please, okay, yes. Okay, let's do it this way. It's probably easier. Then we can say it's okay between the dermis and epidermis. Yeah, this and these are going to be as okay what we call the dermal papillae. Where okay, yes, papillae mainly is okay. There's not something it's okay that may is okay or mean is okay. Something that looks like finger-like projections is going to be called papillae. Okay. If some of you have ever heard of okay something that they call is okay a polyp, and also it's okay be referred to as a pinna papillae, because it's okay as something that looks like a bigger or smaller finger-like projection. But that's mainly it's okay what we call these okay this wave-like arrangement between it's okay the epidermis above and the dermis below. Did you guys get that?
Yeah.
Yes.
Okay. Do you guys mind if I go to the next slide?
No.
So we can say it's okay the dermis. Now, guys, dermis, well, okay, yes, in most part of the body. So generally speaking, yes, okay, it is going to be, yes, okay, the thickest layer of the skin. It's going to be the dermis. Generally, yes, okay, when we look through skin, yes, okay, okay, at different areas of the body. In most areas, okay, we actually find that, okay, yes, the dermis is the thickest layer of the skin. Now, guys, this is also, yes, okay, now. This skin, yes, okay, or the dermis contrast to the epidermis is going to, yes, okay, have blood vessels. It is also, yes, okay, going to be the layer where we actually also will find, or we can call it, okay, the nerve endings. Is that clear? Now, as far as, okay, yes, the glands of the skins are concerned, the glands. of skin, which will mean that's okay, which are going to be as okay, primarily as okay, the sweat glands. The glands of the sweat glands are going to be found in the dermis. It's also going to be as okay, another gland that we were talking about, which is going to be as okay, the sebaceous gland. Now that gland as well, yes, okay, is going to be found in the dermis. Even yes, okay, structures such as okay as the hair follicle is found in the dermis. Okay, now from the hair follicle, that's okay, that's mean it's okay, where we will have, yes, okay, we can say it's okay, the hair shaft. Now pretty much okay as attached to the hair follicle. Attached to the hair follicle is there going to be a muscle, which at one end is going to be attached to the hair follicle. The other end is mean going to be attached to this. Well, okay, yes, the dermal layer of the dermal papillae. And this muscle here, guys, that is going to be called the erector pili muscle. Erector pili, sorry, I knew that. And this is going to be a muscle. Is that clear?
Yeah.
Okay, guys. Now, as far as the hair follicle and so on so is concerned, yes, okay, we not really, yes, okay, going to be much concerned about that. But we may, yes, okay, talk a bit about this erector pili muscle. Because mainly going to, since we say it's okay, it is a muscle. What is it that all muscles have in common that makes them muscles?
They're made of tissue.
Okay.
Contractile.
Exactly. That they can contract. And what they mainly say is, okay, what happens when, okay, this muscle here is, okay, contracts. That is actually is, okay, going to cause the hair to stand up. Now, this is less developed in us human beings, just okay, compared to other species of animals. Especially as okay, when you talk just okay, animals like okay, dogs, cats, and even birds and so on. So okay, well, what the contraction of okay, this erector pili muscle has okay may cause. Well, okay, yes, it may cause okay the hair follicles or here, sorry, on the skin to actually stand up. Okay, but in us humans, yes, okay, what it means is okay, what lead to is okay, yes, okay, what you call goosebumps. So guys, okay, next time, yes, okay, get goosebumps. Just look at, okay, yes, here in that area, and you may find that, okay, yes, it is standing up. Now, what will happen in animals if the hair stands up? Who have dogs? It now has it ever happened that okay, yes, you might find a ridge of hair on the back of your dog stand up?
Yeah.
Get now you know why. That is due to yes, okay, the contraction of the erector pili muscles to those hair follicles. Now, why would that happen?
It's in response to something usually.
Okay, you know what that something is.
Hmm.
Or what is it that your dog wants to tell you?
Either that there's something bad around. His hair only goes up if
Mhm.
he doesn't like someone or something.
It's actually yes, okay, a way of well, okay, you could signal that okay, they are scared. But just think, yes, okay, of this. That doesn't mean that's okay how it works. You is okay for a bird like okay, a chicken. Or let's say it's okay, a male chick, a rooster. The first spreads out. So that actually is okay, make them look bigger. And that way it's okay telling the other fellow, well, okay, I'm bigger than you now. So don't come close. Alright, because it's okay, it's okay, art is okay. Challenging, okay. Well, okay. It's a fight, fight, or flight situation. Have any of you ever seen rooster fights? Rooster fights fighting? No? Okay. Have any of you ever seen a peacock spread out the feathers of his or her of his tail? That's the same thing. Okay, that happens. But you can say it's okay. In humans, just okay, that is less developed. Okay, in humans, it's okay, it's okay, you may it's okay, just call that goosebumps. Now I may ask a dumb question. Because okay, we said okay, this erector pili muscle area, yes, okay. It is a muscle, right? It's a muscle. My question is going to be what type of muscle?
Are you asking what type of muscle the erector pili is?
Yes, please.
Okay.
Wouldn't it be smooth because it's involuntary? Like whole your body reacts and then your hair stands.
Exactly. Good. It's a smooth muscle. Okay. At least somebody didn't say cardiac. Okay. It's a smooth muscle. Maybe that's okay because it just happens pretty much okay as automatically. Okay. You really don't are you really not going to be able to just okay control it. Okay. That's one way by which you can actually figure out that it's a smooth muscle. Second is okay, it couldn't be a skeletal muscle because okay, what was going to happen or what was going to be as okay a criteria for a skeletal muscle that is connected to as okay to the scab bones of the skeleton, and that's not the case here. Is that clear?
Yep.
Right. So yes, okay, the erector pili muscle mainly as okay is going to be as okay a smooth muscle. Okay, connected between as okay the dermal papillae and the hair follicle, and contraction of this muscle here actually is going to cause the hair to stand up. Okay, that hair standing up as okay, that's more as okay developed in other species like cats, dogs, and so on. So, but in humans, that's okay. What it does do is okay, it may give you the goosebumps. Did you guys get that?
Yes.
Yes.
So, okay, don't worry. So just so you look here, guys. Okay. So we can say it's okay. This part here. Oh, it's probably a wrong color to choose. Because that's okay. This part is okay. That is your hair follicle. This is okay. Yes, your hair. Okay. And the same here is okay. This was the hair. You can say it's okay. Okay. This was the hair follicle. And what we mean is okay, just have here. This, or in this case is okay, this is your erector pili muscle. So maybe it's okay, what's going to happen when it contracts? That's okay, the hairs, which might have been lying down like this, comes out of the stand. Okay. So a cheat to remember is okay, what your erector pili muscle is going to be. It's okay, mainly it's okay attached to the hair follicle. So we can say running between it's okay, the hair follicle and the is okay, dermal side of the dermal papillae. Did you guys get that?
Yeah.
Yes.
Good. Okay, guys, now just take a short break and I will see you guys back at, should we say, 10:50ish. Okay. Welcome, guys, or welcome back. Okay, guys, any questions? At this
So
point,
far,
any
good.
questions? Nope. So everything clear so far?
Yep.
Good. Okay. So guys, what we said so far is, okay, yes, we had skin, and in skin we had epidermis, epidermis, that's what it should be. The hypodermis, also known as the subcutaneous layer. Yeah. And what the subcutaneous layer mainly is going to be made up of is made up of what we can call it, okay, fatty tissue, where the fatty tissue itself is known as a tissue, is going to be called, okay, the adipose tissue. Okay. Now, guys, if we look at it, the word subcutaneous, the word sub actually is, okay, meant under, where OUS is pertaining to, and Q chain is just another word that means skin. Okay. All is okay. If you look at the name, it's okay. It may be called as, okay, the layer of skin, as, okay, the layer underneath the skin, but it is still, yes, okay, considered to be, as, okay, a part of skin. Is that clear? But as far as, okay, the subcutaneous layer is going to be concerned, it's mainly, it's, okay, made up of fatty tissue, which we actually can call the adipose tissue. Did you guys get that?
Yes.
Good. Okay. So if we is, okay, where were we? Good. If we go back to our diagram of the skin, we can actually say that all is, okay, this here, all this is, okay, all these yellows bubbles here, it's, okay, that is going to be, it's, okay, your subcutaneous layer, which is actually made up of adipose tissue, which is fat, but this subcutaneous layer can also be called the hypodermis. Okay, mainly it's, okay, because it is below the dermis. Did you guys get that?
Yes.
Okay. Now we may ask ourselves, And okay, yes. What is the purpose or function of is okay the subcutaneous tissue? Now, first of all, it's okay, we just look okay so what it is made up of. It's going to be made up of fat. Clear? Okay. Now, guys, some people may think of fat as mean it's okay, a curse. Okay. But this fat here is okay, actually is going to be, we can say, okay, the depot of, or we can say a depot of, or storage of energy. Mainly because, okay, as we talked about, as we mentioned in our previous chapter, was that okay, as energy or fat actually is okay was storing a lot of energy. Okay. So that's okay. That's actually going to be as okay. A way by which is okay, your body may be storing energy. Okay, or we can say it's okay, a rich source of energy. Yeah. Another thing, guys, is well, okay, as just thinking of it, the composition of fat, it actually it may act as okay as a cushion to the body. Okay, so in certain areas, as okay, it's actually as okay going to act as a cushion, mainly as okay between as okay up to the body, most likely as okay between as okay bones, and just okay because that's okay the outside environment of the body. Okay. Last but not the least, yes, okay. This fat here is not going to act as a cushion, but it's okay, it can also act as an insulator. To yes, okay, because it's okay to prevent loss of heat from the body. Yeah. Did you guys get that?
Yeah.
Yes.
Right, okay. Now, as we said earlier, as I mentioned earlier, as okay, the thickest layer of your skin was the dermis. Okay. But on the other hand, we can also say, okay, there are going to be okay areas of the body where you mainly will say, okay, that the subcutaneous layer is okay, maybe it's okay, the thickest layer. Or where you mainly say, it's okay, that if we cross, that's okay, if we make a section, it's okay through the skin. Okay, there's no question about it. It's okay, the epidermis is always going to be, it's okay, the thinnest layer. Okay, but yes, okay, in certain parts of the body, mostly it's okay, in most part of the body is going to be, it's okay, the dermis, which will be the thickest layer, followed by, it's okay, the subcutaneous layer. But then there also is okay, maybe it's okay, areas of the body where it says, okay, we have the epidermis, then we have, it's okay, the dermis, and it's like the subcutaneous layer, maybe thicker. But you mean it says, okay, why is it going? Yes, okay. Why is it that the subcutaneous layer is going to be thicker in these areas here? Because that's mainly it's okay where we have a lot of fat deposited. Now, guys, irrespective of the sexes, so that's okay. Sorry, both in males, females, and males. Okay, areas is okay where we have, yes, okay, we can say it's okay. Yes, okay. The subcutaneous layer is okay, being, yes, okay. The thickest layer of your skin is mainly as okay going to be as okay on the sides of the thighs. And okay, yes, in some instances, okay, the upper arms. And it's okay around the belly. Okay. Whereas there's going to be as okay two main areas where there's going to be as okay a greater deposit of subcutaneous fat in the females versus the males. And that's going to be okay around the hips. Also, yes, okay, in the breast. And last but not the least, and okay, as that's why we says, okay, that's going to be as okay, what we call as okay, a knuckle fat body. Now, guys, if you guys remember the other day, I briefly as okay mentioned as okay what this knuckle here meant. NUCHEL. That was meaning that's okay, the back of the neck. So that's okay. That may as okay be as okay a hump of fat. It's okay found on the back side of the neck. Okay, and that area is okay, that's what we call it. It's okay, the knuckle area. Yep. You can see it's okay around the hips, that's me, it's okay going to cause us okay the women to have that. You can say feminine effect. And okay, ladies, a guy is okay. If you look at the breast, for instance, well, okay, you may say, okay, we got the mammary glands with the ducts and so on. So, but besides that, yes, okay. Or mainly that's okay, makeup, yes, okay, the breast is me, yes, okay, just going to be a greater or lesser amount of fat tissue. Right. Okay. So generally speaking, yes, okay, these are being, yes, okay, the areas in the, whereas, okay, the female counterpart has a thicker subcutaneous layer than that of the man. So around the hips, in the breasts, and okay, yes, that knuckle fat body, which is a big or small, that's okay. Hump of fat is okay on the back side of the neck. Did you guys get that?
Yes.
Any questions?
No.
Good. Nice. Okay, so hopefully, yes, okay, you guys can, yes, okay, see the diagram of the skin again, right?
Yep.
Good. Now, guys, the next thing that we will be talking about is going to be, yes, okay, this fellow here, or this fellow. And we actually, it's okay, call that, okay, the sebaceous gland. Don't have it labeled here. No, okay. Okay, yeah, okay, it's not here. Sebaceous gland. Yeah. So this is going to be as okay, your sebaceous gland. And you may see that, okay, yes, it actually is okay, opens up into, yes, okay, areas, okay, around with your ear shaft. Okay, whether it was here or whether it was here. So that should be, yes, okay, sorry, a cheat to remember. Okay, so sebaceous gland. Now, guys, first of all, yes, okay, when we say gland, what would that mean?
Secretes a secretion.
Exactly. Okay, because it's okay, it's going to be, it's okay, a group of cells that secretes secretion. Now, guys, that's okay. Here, this secretion here, that's actually, it's okay, what they call it, a sebaceous. But the name of the secretion here, because there's okay, the secretion of the sebaceous gland is known as sebum, S-E-B-U-M. Is that clear?
Yes.
Yes.
Good. Okay. And when we talk about, yes, okay, sebum, well, okay, yes, what is it going to be? This sebum here is okay, is an oily secretion. Now, what is going to be, is okay, the purpose of being oily? Why do you think that, okay, that's the sebum? Why is it oily? What's the purpose? Any guess?
To keep it lubricated. Sorry, I can't.
Exactly,
Like moist
exactly.
or lubricated. Yeah.
It's for lubrication. Because, okay, what would happen if your skin wasn't lubricated?
It would be dry and cracked.
and crack. And when skin cracks, what is that going to lead to?
Infections.
Or you're gonna say, yes, okay, okay, that may be extreme, but that's going to just okay lead to a breach in the first line of defense, right? And that means yes, okay, just provides a port for yes, okay, all yes, okay, small cryptic creatures to yes, okay, be able to get underneath the skin or into a whole new world, and then flying around on a magical carpet. Did that make sense?
Yes.
Yes.
Now, good is good, but then too much good is bad. Okay, so yes, okay, some people, yes, okay, may, yes, okay, produce too much sebum. That's why it's okay, it's going to, yes, okay, that the skin, yes, okay, maybe, yes, okay, too oily. And that okay, can actually become a, yes, okay, it's okay, become a problem as well. Yeah. But prime, yes, okay, the whole purpose of it is okay, being oily is mainly yes, okay, to lubricate. Why lubrication? Well, okay, yes, to prevent drying, because that drying is going to lead to cracking of the skin. And then you can just go on and on and on. Did you guys get that?
Yes.
Yep.
Good. Now, guys, somebody may say, well, okay, what may control, yes, okay, because it's okay, secretion. What may, yes, okay, control the secretion of sebum? How is that going to be regulated? Now, most likely, yes, okay, they say it's going to be, yes, okay, hormonal. It's going to be, yes, okay, the hormones, the hormonal secretions. And that's why, yes, okay, that's where, yes, okay, some other thing, yes, okay, may kick in. Because we can say it's okay. It may be as okay due to the hormones, it may be as okay due to other things. But it's okay, people can actually, it's okay, develop what we call a sebaceous cyst.
Is that a pimple?
A pimple was a good example. But why?
The oil builds up because the ducts get blocked.
Okay, what's going to cause the? Oh, you can say, well, okay,
There's too much production of it.
well, okay, now you can say it's okay. The production of sebum is okay, maybe is okay, controlled by hormones, right?
Yes.
Okay, now we can check. Yes, okay. So we said, okay, we had the sebaceous gland. It is producing the sebum. Clear? And yes, okay, that's sebum. That's okay. Maybe yes, okay. Yes, that's okay. Release, that's okay, through ducts. That opens up, says okay. In most instances, okay, right next to the pores of the hairs. Oh, yes, okay. Even irrespective of, yes, okay, did we say, here, yes, okay. It may just have its own duct through which, yes, okay, it may secrete this sebum. Now, my dear, the secretion of the sebum here, yes, okay, is under the influence of my God, okay. Hormones. But what mainly, yes, okay, also happens around the age where, yes, okay, hormones kicks in. Where is it at most? Well, okay, back in the day, we usually just say girls would use makeup. And what did that do? Block the pores. Clear? Now, whatever sebum is being produced, well, okay, yes, it can't get released onto the surface of the skin due to whatever has blocked the pores, openings of the ducts, if that's what you want to call them. Now, your gland will not be able to know that, and it just keeps on producing. And what happens? That becomes as a big accumulation of sebum in the duct, and actually it's becomes like a big cyst-like structure. Is that clear?
Yeah.
That's pretty much as how most young and teenagers end up developing pimples. Now, it's not always going to be due to the sebaceous gland. In many instances, it can also just be directly under the direct influence of the hormones. Okay, so some of those other changes that the hormones may lead to is generally just development of pimples. Okay. But this could be another reason. Then somebody will say, well, then what about men? Can men develop sebaceous cysts? Yes, guys.
Yes, they can.
And why?
Like an elevated level of androgens.
Well, the hormones, but one may actually cause them to develop it. A broken hair that blocks the pore. So it's if men don't shave the proper way, that can actually cause the hair to get. It may sound crazy, but broken.
Is that like when an ingrown hair grows?
Exactly.
Okay.
Okay. So yes, that may cause it. Oh yes, due to whatsoever reason, yes, bacteria or germs may be able to travel through that duct and reach to the gland. Okay. Any questions about the sebaceous gland or sebaceous cyst?
No.
A, maybe. So the substance it produces was sebum. What was that? An oily secretion. Mostly as okay under the influence of hormones. Okay. So and so. Okay, guys. Now our last gland, if you want to put it that way. Other gland that we may be talking about. You guys can see the PowerPoint?
Yeah.
Okay. And you may see it's okay, this curly fellow here. It only is okay, just made one. But then you can say at least through it's okay, through a duct which opens up here. There would have been a similar one here, a similar opening here, a similar opening here. You know, say an opening here, so and so. But this is going to be as okay where we commonly as okay just will call a sweat gland. Clear? Okay, at these here is okay. Or mainly is okay, just openings of the sweat glands. Did you guys get that?
Yep.
Good. Now, guys, why do we call sweat glands sweat glands?
Because that's where we sweat from.
Okay. But that's okay. Why were the glands? Meaningless, okay, we can say it's okay. Secretes secretion. Clear? What do we call the secretion here? It's okay, we call it sweat. Okay. Is that clear?
Yep.
Yeah.
Okay, guys. Now the sweat glands. The sweat glands can also go under the name SUDO. RIFEOUS. Glands. So you can mainly say that, okay, yes, this here is a fancy word for sweat. SUDORIFEROUS. Glands. Now, guys, just like your what you want to call it, just like your what the hell was it you call it? Your sebaceous glands. Okay, just like your sebaceous glands, just okay. So is your sweat glands. Roughly speaking, yes, okay, are going to be exocrine glands, because okay, they do not secrete the secretions into the blood. Okay, but as far as the sweat glands are concerned, it's okay, they can be divided into two subtypes. So we can have as okay what we call as okay the eccrine sweat glands. And the other type of sweat glands is going to be as okay what we call as okay the apocrine sweat glands. Is that clear?
Yeah.
Yes.
Right, okay. Now it's okay how this distribution of the sweat glands mainly as okay we can say it's okay due to it's okay the nature of the sweat, or we can say the constants of the sweat being produced, and or yes okay due to the distribution of these sweat glands here. So guys, the eccrine sweat glands. Right, okay. Now, first of all, it's okay. This is because okay, the sweat that is going to be produced is going to be as okay hypertonic sweat. So it's going to be as okay dilute. Is that clear?
You said hypotonic?
Hypertonic.
Okay.
Okay. We can also say as okay now what actually is okay causes this group here of sweat glands yes okay kick into action. It is mostly as okay for as okay what we can call as okay thermoregulation. That's how we can mean say okay thermal. It's just going to be as okay a fancy word for heat. Right, okay. So mainly as okay, as I said the other day, is okay. The sweat that you may produce to is okay, where its purpose mainly is okay was to cool down your body. It's going to be as okay due to as okay you were eccrine sweat glands. Because again, we say thermoregulation, I mean, it's okay, reduce, we can say it's okay, the body temperature. That's pretty much okay where these sweat glands here is okay, kicks in. Is that clear?
So it regulates the temperature of the body.
Yes.
Okay.
To cool you down. Now, guys, that's okay. Comes the question. That's okay. Rightly, that's okay. Where is it that they are going to be as okay found? Where do you find these eccrine sweat glands here? They are mainly as okay found on because there's okay non-hairy areas of the body. Which is well, okay, as the palms, the feet, and the forehead. Now some of you may is okay. Know that okay what sweaty feet can lead to. Stinking feet. Okay. Mainly that's okay when people just okay sweat from these areas and mostly that's going to just okay be due to just okay the you can say it's okay action of just okay the eccrine sweat glands. Which mainly as okay was we can say okay mainly as okay to prove as okay act as a thermoregulator. Did you guys get that?
Yep.
Yes.
Okay. Now your apocrine sweat glands. Your apocrine sweat glands. Now that's okay. First of all, that's okay. Well, okay, yes, we can say okay that, and that may not be hypertonic, but that's okay as far okay the consistency of the sweat that it produces is thicker. Then okay, yes, that of the eccrine sweat gland. Okay, we can also say that okay, as these sweat glands, yes, okay, they are mainly yes, okay, going to be found in, I guess it's okay, hairy areas of the body. Okay, which mainly is okay is going to be as okay because it's okay the underarms or armpits or axilla. And okay, yes, around the genitals. Is that clear?
Yep.
Good. Now, guys, this sweating is okay from is okay. This category of sweat glands is not going to be as okay for your thermoregulation. Or it's not due to as okay. They're not going to kick in, yes, okay, due to yes, okay, an increased body temperature, mostly. This is most that's okay going to yes, okay, be yes, okay, under the influence of okay, your nervous system. Getting scared or something like that. And or yes, okay, hormonal. So the hormones. Is that clear?
Yeah.
Okay. So not for thermoregulation, but that's okay, it's okay. As a response of hormones, or it's okay, your nervous system. And as far as okay, yes, is difference between yes, okay, the regular sweat and this here is that okay, yes, is okay may give the person has okay a specific order. And that's why it's okay, many people it's okay may use deodorants. Again, it's okay, maybe because it's okay that the sweat that they produce is having it's okay a strong odor. But guys, not just the order is okay, but it's actually it's okay, going to be it's okay, very specific. From person to person to person to person. Now you may say, well, okay, I don't sense any difference. Whereas this person or that person who is okay walks into the room. Again, it's okay, those of you who have dogs would know that okay, as your dog is able to yes, okay, catch up your scent. And know it's you. Because literally it's okay, they can't see you in 3D. Dogs doesn't have 3D vision. So the ends, so as you get their sense of sight is poorer than that of the human, but that causes them to have is okay, a nose which is 10,000 times stronger than that of a man. And okay, as so is their hearing. So that they can actually just okay smell and catch that specific order which tells them, okay, this is master, this is box. So don't bite. Or don't bark. Did that make sense? Okay. Any questions?
No.
Nope. So no, yes, okay, you may, yes, okay, put up a smiley face or a happy face. But it's okay, that four-legged fellow can still smell that you are nervous. Now you know why. Good. Okay, guys. Now, in the epidermis, let's just go back to the epidermis. Because, okay, where was it we found in the epidermis? If it says, okay, we had the epidermis, we had that. Jesus, okay. Cells that looks like this. And that was what we can call as, okay, the melanocytes. Where now here is, okay, the word melan. It's from melanin, which is, okay, as the name of the pigment. O was our favorite combining vowel. And sites was cells. So these were your pigment cells. Did that make sense?
Yep.
Okay. So that was okay as far okay the skin is concerned. That is mean is okay going to be as okay the cells that will give you as okay your skin the color. And it's going to just okay be determined by as okay the amount of melanin produced by the melanocytes. So how much melanin is it that they contain? Is that clear? Now we can
Yep.
also say it's okay now. This melanin here is okay. Doesn't only as okay, you can say okay, provide is okay, the skin, its color. It may indirectly as okay as have okay, as a protective function to the skin. Protection against what? Ultraviolet light, which is okay as a common factor known to yes okay cause skin cancers. Now we can say it's okay that melanin has that protective function. Because guys says okay, it's comparatively rare to see as okay people of color, black or brown, to develop skin cancer, contra to Caucasians. Or whites. Other structures in the body where yes, okay, we also yes, okay, may find yes, okay, melanocytes or melanin for that matter of fact is going to be here. But then you also yes, okay, find in the yes, okay, in the eyes. Which part of the eyes is okay? The part that we call the iris. And that's actually yes, okay, that color disc in your eye that gives you yes, okay, your eyes the color that they have. So somebody is okay, have blue eyes, that's okay, that's due to it's okay that the color that the melanin gives it. Okay, somebody may have yes, okay, brown eyes, somebody may, okay, I don't have hazel here, but anyways. Whatever. Okay. Now pink eye doesn't mean that okay, yes, that they have but actually that's okay, the melanin in the iris that actually is okay gives it the colors. Clear? Now, guys, there are people who are completely sorry, because it's okay, depleted of melanocytes or melanin. And that's what you call albinos. Okay, where the word albino actually is okay comes from the word alba, which means white. Okay, and a person who is okay by race is what you may call as okay, Negro. Can he or she be an albino? By race, he is black, but hey, can he be albino? Which means okay, white. Yes. racially it's okay, or you want to put it that way, it's okay. He may be born off black parents, but can still be albino. Because, well, okay, he just end up as okay, not being producing any melanin. And that's why you can make sense, okay, that okay, yes, melanin, yes, okay, have a protective function because okay, albinos are more likely compared to yes, okay, regular, yes, okay, you can say it's okay, people of white complexion or whites to develop skin cancers. Not to talk about things such as sunburns. So it's okay, they are superly duperly photosensitive. That's why it's okay, if you see an albino, yes, okay, they will have, yes, okay. Either are going to be wearing sunglasses or yes, okay, either going to be closed like this because of the light from the sun being too strong, because they are too photosensitive. Any questions?
No.
No. Okay, girls. What about your nails? What do you think makes up your nails? Not the nails that you get from a nail salon. Not those nails. Mother Nature gifted nails. What do you think they're made of?
Keratin?
Keratin. And that tells you us, okay, what makes them hard. Okay. But on the other hand, you can say it's okay, they are also dead. That's why you don't feel any pain when you cut your nails. Unless you cut them too deep, but that's mainly just okay because you hit the nerve on your nails. Right, okay. Likewise, yes, okay, your hair is also made up of keratin. And that's why you may not feel any pain, yes, okay, when your hair is being cut. Is that clear? No, then I say, yes, okay, there's your superficial layer of the skin. Stratum corneum was mainly as okay, keratinized as well. So how come is it that okay, as a paper cut hurts like shit? That due to yes, okay, the sensory nerve endings. Okay. And we can yes, okay, just talk a bit about yes, okay, burns. Have any of you heard of burns?
You say burns?
Exactly. B-U-R-N-S.
Mhm.
Good. Does anybody know the grades of or categories of burns?
Yeah.
Yeah.
Isn't it well it's like levels 1, 2, and 3. 2 and 3 don't hurt because it like burns through the skin. Like through past it burns the nerves. So then you
Okay.
don't feel it.
Is that you, Caitlin?
Yes.
Okay. Now you may carry on with the lecture.
No.
because you already said what I was going to do. See, first degree burns is just your epidermis. And the reason that this hurts is because, okay, your nerves are still intact. Whereas they say it's okay, second degree burns. Well, okay, not only this, but also it's okay, this here. And God forbid this. So that would be it's okay. Second degree burns. But the reason that, okay, as they are painless is because it's okay, the nerve endings are damaged. And guys, God forbid that you see it's okay, third degree burn. Especially it's okay on areas like, okay, it's your limbs and so on. So that's why actually it's okay that you have not only it's okay burn of your epidermis, dermis and hypodermis, but also it's okay, even it's okay, underlying muscles will be burned. So in some areas, okay, actually it's okay, may be able to see it's okay, the underlying bone and so on. So for me, it's okay because the nerve endings are damaged. Second and third degree, that's why that they are painless. So that was the 3 degrees. All dependent upon is okay, the thickness of the skin being burned. And then you may hear somebody is okay, percent. This many percent, that many percent. Now, what is that percent going to go by? The media says, okay, have divided the body into areas of 9% each. And that's okay, yes. Those areas, 11 of those areas makes up 99%, and then there's just 1% left. And that 1% area is accounting for the genitalia. So that's why you may hear, okay, somebody have, okay, has 90% burns, second degree, first degree, or so and so. Okay, guys, so this was all I could offer for the integumentary system. I hope you guys are aware, yes, okay, what was going to be on your chest, right?
The test that's coming up on Wednesday.
Yes,
Yeah.
I already told you guys.
Mhm.
Okay.
Can I ask a quick question about the epidermis?
Mhm.
So I know you talked about those 2 layers, but I know there are like 5 within. Do we need to know the 5?
What do you mean the 5?
Like the basal,
No, just remember, listen. That's because practically, yes, okay, the epidermis is mainly, yes, okay, just made up of 2 layers.
okay.
Outer layer was the stratum corneum. Deeper was stratum genimatimum. Clear? Okay, but remaining says, okay, just separates your epidermis from the dermis was what we call as, okay, the basal membrane.
Okay, I just wanted to make sure we didn't need to know like the stratum lucidum and like all.
No,
like
no,
that.
no, 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 no,
Okay.
that's too much. Okay.
Sounds good.
Anything else, Maria?
That's it from me.
That's it for you. Anybody else?
Oh, so the chapter 3, 4, 5, well, everything else, I guess. We don't have another quiz from this Wednesday until the midterm,
Yeah.
correct?
Hmm.
Okay. And then the midterm is just a cumulative of everything we've learned so far.
What I announced. I said, okay,
Oh, okay.
from beginning to this point, yes, okay, that's going to be on the midterm. Okay. But mostly, yes, okay, your quizzes are not accumulated. That's just going to be like small chunks. But your midterm is going to be as, okay, accumulated from as, okay, what we may have done from day one till I say, okay, up till here, yes, okay, that's going to be included on your midterm. Okay, yeah. But again, once I announce it, it's okay. The day may go one day back forth. Okay, hopefully not. But it's okay. The chapters will remain the same. Okay. Okay, guys. So okay. Now take your lunch break and when you guys come back, we may take a little jump and just for today, yes, okay, skip chapter 4. Okay. Okay. And go to chapter 5 and see if we can finito that one as well. And in chapter 5, guys, it's okay, although it says, okay, the skeletal system, but it's going to only be, it's okay, certain points that we talk about, and that'll be it. Okay, so would it be fair enough to say that I see you guys back at 12:50?
Yep.
Okay, lady, guys, have fun to them.
Thank you.
Any questions?
Nope.
No, guys. We may, yes, okay, just jump to chapter number 5. And say, yes, okay. Now, what's that going to be about?
Muscular system.
The muscular system. Now, guy, usually it's okay, although it's okay, we know that we got 3 types of muscles, right? Okay, that's okay. We got the skeletal muscles. We have the smooth muscles and we have the cardiac muscles. Okay. Now, guys, but when we talk the muscular system, they mean it's okay, we refer to it's okay to the skeletal muscles. Okay. Is that clear?
Yep.
Yes.
But what all three muscles had in common, whether they were skeletal, smooth, or cardiac, was what we can call is okay contractility. Which means it's okay, just means the ability to contract. Okay. Which means you mean yes, okay, the motion of the muscle in which it's okay, the muscle is going to shorten. Okay. Is that clear?
Yeah.
Good.
Yes.
Now, one of the main things that we as okay may do when we talk about the muscle is, let's say it's okay, we can talk. Or let's just first just okay talk. So what's going to be as okay the function of the muscular system? Okay. Now, first of all, it's okay. We can say that first and foremost, it's okay. Or foremost, the muscle or function of the muscular system, especially as okay if we talk of the skeletal muscles, is I guess it's okay attached to the bones and cause movements of the joints. Is that clear?
Yes.
Okay. So please, guys, it's not going to be the bones that will move. Okay, so the bones will move, but it's going to be as okay across as okay the joints or joint lines. All dependent upon is okay the muscle is okay action of your muscles. Okay, so that's pretty much okay. That's why the major function of your muscles are going to be. Okay, now later on we may talk about as okay some movements of the muscles. Okay, across as okay joint lines. Good. Now, guys, if we find this okay, talk of okay, how is it that a muscle is built up of? Now, practically, that's okay. There's going to be something that is going to be called as okay a sarcomere. Where if you guys okay, look at the word sarc. Was what we previously okay called flesh. And when I say it's okay, when you eat meat, you actually it's okay eating the flesh. Or when you're eating flesh, you actually it's okay you're eating it's okay the muscles of that animal. Okay, but here it's okay. We says okay, what is going to be as okay a sarcomere? We can say okay, that's going to be as okay the basic contractile unit of a muscle. Is that clear?
Yep.
So let's just okay, where are we? You guys can see the book. Oh, book,
Yeah.
book, book. Yeah,
Yep.
okay. So we just look here, guys. Or maybe it's okay. Now what this whole thing here is going to be. Wow. Sorry, guys. Okay, guys. This will- No, it's okay, no lights. Let's go. Hmm. I don't know what the fuck. Hmm. This is shit. Sorry. Okay. You guys can see the No. The picture from the book right now, right?
Yeah.
Yep.
Okay. Okay, guys. So what this whole thing here is going to is okay. One. Okay. Is going to be a muscle. Okay, so this is going to be a muscle. This thing here, that's going to be a sarcomere. Okay. Now, guys, this is mainly as as an enlargement of the sarcomere. Where we mainly can see is that it actually is going to be made up of two types of proteins. Okay. I'll just go back to my own way. This is so a sarcomere is mainly just going to be we say that it's this whole structure that we will make here. Is going to be sarcomere, which is mainly going to be made up of two basic muscle filaments. Of filament proteins, which are going to be respectively what we call actin and myosin. Is that clear?
Yep.
Now, some people may also refer to to the actin as the thin filaments, and the myosin as the thick filaments. But while your actin and myosin were what you call muscle filaments. They're going to join together to make a sarcomere. Now, guys, when we talk about the actin, what the actin actually has going to have is structures like these. And these we can actually say, will be referred to as the head of the myosin. Is that clear?
Yes.
Good. Okay. Now I know that your book talk about things such as okay, the Z line, the edge zone, the M line, and things like that. You don't need to worry about that. Okay, so just take a look at this here is going to be as okay, sarcomere, which is going to be as okay, the basic contractile unit of the muscle. Okay, did that make sense? Now we can mainly say that okay, as a series of sarcomeres or we can say it's okay, sarcomere plus sarcomere plus sarcomere actually is going to make up what we call a muscle fiber. Is that clear?
Yes.
Okay. Now, the muscle fibers. Or we can do this way and say it's okay that muscle fibers are covered by a membrane. Okay, so the muscle fiber that's going to be covered by a membrane called the endomysium. Did that make sense? Okay, so if we do it this way and say it's okay that we have a muscle fiber. And just say do it this way and say it's okay, the muscle fiber. That muscle fiber is going to yes okay be covered by a membrane. And that is going to be called the endomysium. So we will actually as okay have we can say as okay multiple muscle fibers like these, where each of them are going to just okay be covered up by their own membrane, which will be yes okay what we call the endomysium. Did that make sense?
Yeah.
Good. Now what we actually can now say is okay, yes, this group of muscle fibers here. Okay, this is now a group of muscle fibers, right? Did that make sense?
Yeah.
Okay. Now these groups of muscle fibers, okay, this group of muscle fibers here may be then yes, okay, covered up by another membrane. And that is going to be yes, okay, what we'll call the perimysium. But what we actually can say that okay, this group of muscle fibers plus muscle fibers here make or become yes, okay, that's going to become yes, okay, what we call a fascicle. So this group of muscle fibers here joined together is going to be called a fascicle, and that fascicle is going to yes, okay, be encircled by its own membrane called the perimysium. Did you guys get that?
So the fascicle is covered by the paramecium.
You can pretty much put it there. Yeah.
Okay.
But what makes up the fascicle? XYZ number of muscle fibers. So whatever is found inside is okay, the paramecium, this whole thing here is okay. We can say it's okay, will be a fascicle. But what makes it? Meaning that's okay, just XYZ number of muscle fibers, where each muscle fiber will be covered up by their own membrane called endomysium. Did you guys get that?
Yes.
Good. So we can say, okay, this would be as okay, one fascicle. We may have okay as another fascicle, another fascicle, another fascicle, another fascicle, another fascicle, another fascicle, like this. Okay, where they all are going to just okay be made of their own. We can say it's okay, muscle fibers. Okay, and each muscle fiber is going to just okay be covered by their own membrane called endomysium. But this group of muscle fibers covered by the paramecium makes up fascicles. So what do we have now? Yes, okay, now we have multiple fascicles, right? Fascicles, yes, okay, joined together. Okay, and these fascicles now joined together in one group, yes, okay, they're going to be covered by their own membrane. Did that make sense? Now this membrane here is okay, that is going to be called the epimysium. Did that make sense?
Yep.
Right, okay. But we can also put it this way that, okay, as this group of fascicles grouped together, covered by a membrane called epimysium, that is going to make your muscle. Did that make sense?
Can you say that last part again?
The group of your fascicles, right? What did we have here? Yes, okay, this was mainly, yes, okay, just a group of fascicles, right?
Yes.
Did that make sense?
Mm-hmm.
Okay. Joined together, I mean, that's okay. Grouped together, I mean, that's okay because they were enclosed in what we call, yes, okay, the outer membrane called the epimysium. But this group of the fascicles here actually were going just okay when they were joined together, that becomes just okay a muscle. Did you guys get that?
Yes.
Okay. So we can say, yes, okay, what did we have? Yes, okay, we had two types of muscle filaments. Okay, which we're going to, yes, okay, which we mean, yes, okay, respect to this, okay, just called the actin and myosin. These will join to become a sarcomere. where sarcomeres were joined to become muscle fibers. Muscle fibers were enclosed in their own membrane called the endomysium. Did that make sense?
Yes.
Good. Muscle fibers grouped together, enclosed in their own membrane. That group of muscle fibers would join, it's okay, join together, be enclosed in the membrane. That we will call as okay. The membrane was called perimysium, but that group of muscle fibers was what we will call the vesicle. Vesicle were grouped together, enclosed in a membrane called epimysium. But that group of vesicles enclosed in the membrane called endomysium or epimysium, sorry, was going to just okay make up a muscle. Did you guys get that?
Yep.
Good. And as far as okay, we can say it's okay. The skeletal muscles are concerned, yes, okay. There's a total of 369 skeletal muscles in the body. So each individual muscle, if you go in the opposite direction, is going to be as okay a group of vesicles joined together, enclosed in an outer membrane called the epimysium. Where okay, as what made the vesicles was mainly as okay, just a group of muscle filaments. Okay. They were as okay, grouped together, covered by a membrane called the perimysium. Where okay, what was a muscle filament? Mainly as okay, just group of sarcomeres joined together, enclosed by a membrane called endomysium. And what made the sarcomeres was mainly as okay, the muscle filaments, actin and myosin, built into as okay, this structure that we had earlier. Okay, as we said, okay, this is going to be as okay, a sarcomere that we actually had. Okay, yes. We have the actin. And we have the myosin. And what was it that the myosin had? That's okay, myosin heads. Is that clear?
Yes.
Good. So microscopically, yes, okay, it comes down to, yes, okay, that structure which we call the sarcomere. Okay, but which is made up of two, yes, okay, contractile proteins. Actin, if you look at the word actin, it looks like, it sounds like action, right? And then you go myosin. Well, okay, okay, hopefully, yes, okay, you'll be able to, yes, okay, recognize what that is. Myo is muscle. Is that clear?
Yes.
Good, thank you. Now comes the question. Because, okay, how is it that the muscle will contract? Now, let's just say, guys, here that, okay, yes, we have a sarcomere. What did we have in the sarcomere? And I just say the right now, okay, we have the actin. And it's okay, we have the myosin. Did you guys get that? And what we said was that, okay, as this myosin here is, okay, has these, yes, okay, myosin heads here. But we can mainly say as okay that, okay, as we say this one here is A, and this is going to be as okay a muscle that is relaxed. Did you guys get that?
Yep.
Good. Where we mainly as okay will just need to as okay get this muscle yes okay from a relaxed state to a contracted state. And mainly says okay, well mainly is okay, it just happens when okay yes a muscle contracts is that okay yes the muscle fibers will shorten. Which means it's going to be that okay yes our muscle here yes okay well okay yes as we had like this and so like this. Did that make sense? Okay, guys. Now, not to go into yes, okay, a whole lot of details. But what we actually have is, well, okay, yes, on these actin, oh, sorry, on that myosin heads here. We actually have, okay, these big structures here, which we call heads. Okay, now they actually, yes, okay, are going to attach onto, yes, okay, receptor sites or receptor areas on the actin filaments. Did that make sense?
No. What they attach to the actin
Exactly. Okay.
and that helps them contract?
Okay. That's just the beginning of it, my dear.
Okay.
Because what's mainly is okay going to happen is okay once the myosin heads attach onto the actin filaments. What these heads here is okay actually is okay may do or perform is as okay what they call a stroke. Where they actually is okay will move this way and this way. And what is that going to do as a result of that? And so likewise here, right? Okay. And this, that's mainly as okay going to mean that, okay, yes, if you look at it, that the actin filaments are broad closer together. So yes, okay, now this is your actin filaments or myosin filaments. And then mainly as okay, just go back and okay, do the same again. Attach to yes, okay, the receptor areas on the actin. Stroke again. Yes, okay, what else do you may have? It gets to this. So what have to actually happen is that okay, the sarcomere shortens. Did that make sense?
Yes.
As a whole, you can say, yes, okay, as a result of that, the whole muscle fiber will shorten. Which means, yes, okay, where the muscle fibers shorten, the whole fascicle shortens. When the whole fascicle shortens, or when that's okay, all the muscle fascicle shortens, the whole muscle shortens. And when the whole muscle shortens, that's going to cause that's going to actually be what we call that the muscle contracted. But the size of your filaments, where there was actin and myosin, does not shorten. They remain of the same size. Because mainly it's okay, that is going to be as okay due to the striking action of the myosin filaments heads that is going to just okay push or bring the actin closer and closer together. Did that make sense?
Yes.
Okay. Okay. So the sarcomere is okay will shorten, which will cause okay the muscle filaments to shorten or fibers to shorten. Those muscle fibers shortening together cause the whole fascicle to shorten. Well, okay, all those fascicles in that muscle shorten, and that's going to cause us okay the muscle to contract. And when a muscle contract, it will pull. It will mean as okay pull onto the bone of the skeleton onto which that muscle is inserted. And that will actually cause it to move. Now you can make it as okay, in between a movement, that's okay. Because okay, let's put it this way. If I, for instance, okay, want to flex my fingers here, what's going to happen is going to be as okay, these muscles here that actually is okay will contract. Now, okay, I contracted these muscles okay to their max. If I want just okay, contract them again, well, okay, I have to relax. But that's okay. That's mean it's okay what happens. So yes, like, so right now somebody says, okay, holding a cup and sipping off some drink. That's fine. But how is it that okay, as she is able to just okay, hold on to that cup? Mainly because of just okay, the muscles in her fingers and hand contracted. Okay. Okay. But what is it that contraction is going to lead to is that the bone onto which Now what we'll call is, okay, a tendon is attached or inserted onto. That bone will move across the joint line. So I mainly just, okay, use the term that I call the tendon. And some of you are going to say, yes, okay, Mike, what in the is that? Now, guys, what remain, yes, okay, said here. Well, let's put it this way. Let's go and see. Because, okay, what was it that we had? We had three main sheets or types of membranes, right? We had the endomysium. And we may just, okay, say, what was it that endomysium did? Well, okay, we can say, okay, encircles what we just, okay, call the muscle filament. Did that make sense?
Yes.
Good. Then we had, okay, as another membrane. And we may just, okay, call that the perimysium, sorry. And we say that, okay, the perimysium, that was going to be, okay, the membrane that, okay, as includes what we call the vesicle. Right? Then we say, yes, okay, we had a third membrane that we call the epimysium. And that was going to be, yes, okay, the membrane that, okay, yes, includes, yes, okay, the whole muscle. Did you guys get that?
Yes.
Good.
The endomysium is just it.
Encircles the muscle filaments.
Okay.
No, not filaments, sorry. What the hell, sorry. Muscle fibers. I usually confuse those two, sorry guys. Yes, okay, the muscle fibers. But if we do it this way and say, okay, guys, if we look at the muscle, muscle fibers enclosed by their endomysium, right? Did that make sense?
Yeah.
Good. We can say, it's okay, this group of endomysium is okay here. Or it's okay, these group of it's okay, muscle fibers here made what we will call a vesicle. Did that make sense?
Yep.
And okay, what was going to is okay, make the outer lining of this, okay, a coring of this vesicle was going to be okay, the membrane that we called perimysium. Did that make sense?
Yes.
Good. Now we can say it's okay, we may have it's okay, groups of vesicles. Like this, of course, that's okay, each group of vesicle is going to be made up of their own muscle fibers, which are made up of, okay, as the sarcomeres. which are made up of the actin and myosin. Okay. But then we can say, okay, this group of vesicles is now going to, be enclosed by, their own, by its own membrane. This membrane is going to be called epimysium. And this is what makes up the whole muscle. Did that make sense?
Yes.
Good. But, guys, it's only going to be in the actual muscle substance, where we have the muscle fibers, which is made up of the muscle filaments, which is made up of the sarcomeres, which is made up of the actin and myosin. Okay, that will have the actual muscle bulk, as you may call it. Because on either side, let's just say, that if this here is was a muscle. If we say that this here is was a muscle, and why do we call it a muscle? Mainly because it's going to be made up of multiple vesicles, which is going to be made up of multiple fibers, and so on. But guys, on both sides of this muscle, is there going to be a continuation of the epimysium? And let's say it's epimysium. But we actually will have inside the epimysium on both sides is going to be we can say it's also a continuation of what was the perimysium. That in the muscle enclosed, yes, the muscle vesicle. And where we mean is inside each muscle, inside each their perimysium is that was going to be because it's a lot of multiple continuation of the endomysium. But in this part here and this part here is there's going to be no muscle filaments. Forget about sarcomeres. Forget about fibers. So what is it that this is going to be called? This and this here is that's what we'll call a tendon. But if yes, look in the cross section of the tendon, yes, it's going to be the same. Okay, sorry. Outer, just continuation of the epimysium. Is that clear?
Yeah.
There, yes, in the inside the epimysium is made as just going to be as just as continuation of your endomysium or perimysium, sorry. In which yes, there's only going to be as continuation of epimysium. But there will be no muscle filaments, no sarcomeres, no muscle fibers. What we can mainly say is one is this muscle yes contracts due to yes the action of the actin and myosin. That let's just say yes that it may pull onto this tendon here. Because what this tendon here is going to be is that will be, we can say it's attached onto a bone. Well, so is this tendon here. But mainly it's because it's this tendon here is that pulls onto this bone here. You can make it says according to yes the way in which this tendon is will pull onto this bone, this bone, yes, okay, may move across the, joint line between, yes, okay, these two bones here. Did that make any sense? So the tendons doesn't shorten, neither does the bone. And that's why, as okay, we can actually say that, okay, as the bones or the muscles are not directly attached onto the bones. Because what will happen then? As the bones contract or as the muscles contract, then the bones also should have been contracting. And what will that lead to? The bones will break. Clear? So it's going to be as okay on either end of your muscles or the actual muscle bulk. Okay, which is made up of, okay, those muscle fibers, filaments, sarcomeres. But there's going to be okay, a continuation of those membranes that covers the fibers, that covers the fascicle, that covers, okay, the whole muscle. That union of those membranes is going to, yes, okay, be what you call a tendon, which is mainly, as okay, just a round or rope-like structure. It mainly, as okay, will look like a rope. And that is what's going to, yes, okay, be attached onto the bones of the skeleton. And due to, yes, okay, the contraction of that muscle, it will hee-haw on the bone, and that bone, is okay, will then make a movement across the joint line. Did that make sense?
Yeah.
Good. So your tendon is mainly, as okay, just going to be, as okay, a continuation of the endomysium, epimysium, and perimysium. Okay. And yes, okay, makes up a what you want to call it, which is going to make up just okay, what you call a tendon. And it's going to be just okay, the tendons that attach onto the bone and not the muscle itself. Any questions?
No.
No. Okay. Now some of you may ask, okay, where does all this energy come from? Just a simple action of, okay, as you flipping a page on the book or grabbing, yes, okay, a cup to bring it up to, yes, okay, take a sip or sips. Or turning your head to, yes, okay, look who may be entering the room or whatsoever. Involves, yes, okay, a lot of muscle actions, right? Each movement involves, yes, okay, the action of multiple muscles, which needs energy. And that energy is not going to fall down from the blue sky. It's produced by the muscle cell itself in what we call the mitochondria. Okay, so guys, yes, okay, mitochondria, no, sorry, muscle cells, also known as myocytes, is going to be as okay one type of as okay cells in the body which is going to be, we can say it's okay, heavily loaded. It's going to be heavily loaded with mitochondria. Is that clear? Because they're going to be using a lot of ATP. Any questions? Now, if you, for instance, okay, want to carry out an action of a muscle, well, you say, okay, there's a cupcake sitting on that table in the plate. And right now, yes, okay, I really want to take, yes, okay, a big solid bite of that cupcake. What are you going to be doing? Stretching your arm out, yes, okay, get hold of that cupcake, right? But how? Yes, guys. You see a cupcake or you see whatsoever is okay, which may is okay, kick your appetite. Now you're stretching out your arm. The hands and fingers. And sooner or later, it's okay, you're going to go into Cookie Monster mode. But what enables yes, okay, you to yes, okay, carry out all these actions here. Now, guys, we can actually say that, okay, yes, between, let's say, it's okay, a muscle and what we as okay may is okay called the nerve. There's going to be as okay. This area here is okay, which means as okay, roughly can be called as okay a synapse. The synapse is mainly as okay where we can say as okay. In this instance, okay, where okay this nerve is okay comes together with the muscle at a junction point. So a synapse between a muscle and a nerve. So a synapse, which is meaning is okay, just a junction point that is formed between is okay. Sorry, a nerve and a muscle. Generally, it's okay. We can call it a synapse because it's a junction point. Right? Okay. But specifically, it's okay when we talk about this junction point between a nerve and a muscle, that can also, it's okay, be called the neuromuscular junction. Now you see a cupcake, you want to get hold of it. Oh, there's actually going to be as okay chemical signals that okay as will be released from the nerve ending. Now, roughly speaking, as okay, we can call these chemical signals here a neurotransmitter. It's mainly as okay a substance that's going to okay transmit the signal from the nerve. Primarily as okay, this will be as okay a substance in this case that we call as okay acetylcholine. Now, if you guys remember the other day, that's going to be as okay the signal from the nerve. That means that's okay, then we that's okay attach on to acetylcholine receptors on the muscle end. Wasn't that what we call okay reception? Next, we're going to be as okay that this signal is okay was going to be read by the muscle. We call that transduction. And as a response of that, is okay was going to be, as a result of that was going to be as okay be response. Where it's actually as okay going to be as okay the mitochondria and the muscle that was okay produce ATP. Or we can say it's okay utilize ATP that already was there, because it's a running process to cause okay that actin and myosin to get into action. Did that make sense?
Yeah.
Okay. Now, guys, this space here where okay, it's on one end we yes okay have, or we can call this okay the nerve ending. And on the other end, we have, yes, okay, the muscle, or this space of, okay, as of the synapse can also, yes, okay, be referred to as a synaptic. Maybe that's okay, just pertaining to the synapse left. Any questions? Okay, guys. So tomorrow we will just briefly, yes, okay, may start the show with some videos. Mainly, yes, okay, a little bit of okay, yes. I don't have the time to show it today. Okay. And we will talk about yes, okay, something that we know as primers, also called agonists and antagonists, and then we talk about what we call synergistics and fixators. And then we yes, okay, may just look at okay as a couple of muscles, yes, okay, where they're found and so on. So why? Because okay, some of those muscles are going to be an important anatomical landmarks for you guys. Okay. Did that make sense? And then we
Yeah.
can see. Okay, good. Any question, guys?
Nope.
Nope. Okay. Then, okay, I guess I see you guys tomorrow. But, okay, as a continuation of, yes, okay, chapter 5.
Have a good day.
So do you guys have fun?
I think.
Thank
Okay.
you.
Bye.
Welcome. Yeah. Bye-bye.